You should know that breathing problem is characterized by an inability to breathe in and out with ease, which can occur suddenly or develop over time, and may be accompanied by other symptoms, including chest pain, lightheadedness, or cough. You should be aware of all such aggravating factors which makes breathing problems worse, including dust, chest injury, lying down, exertion, breathing in a particular substance, prolonged inactivity, recent surgery, certain times of year, allergies, emotional stress. In the next phase, you should be aware of all such factors that are helpful in relieving pain, which includes certain medications, sitting or standing upright. Now, there are some important questions that you need to ask your patient before making a diagnosis. You will ask the patient what symptoms they are experiencing, including anxiety, confusion, lightheadedness, lethargy, fever or chills, night sweats, blueness or numbness in lips or fingers, cough, coughing up sputum or blood, wheezing, noisy breathing, swelling, weight change, the influence of being upright on your ability to breathe, chest pain, ankle swelling, previous chest X-rays, electrocardiograms, tests of lung function, and allergy skin tests. You will ask your patient if they or anyone of their family has had any of these conditions: heart disease, high blood pressure, obesity, pneumonia, chest surgery, anemia, tuberculosis, AIDS, allergies to drugs, eczema, hay fever, lung failure, chronic lung diseases such as bronchitis, emphysema, or fibrosis. You will ask the patient if they smoke cigarettes, and if so, how many and for how long. You will ask the patient where they have lived, and if they have worked in certain professions linked to breathing problems, such as mining, stone carving, painting, and quarry work. You will ask the patient if they are taking any of these medications, including medications for asthma, digitalis, diuretics or water pills, medications for high blood pressure, steroids, antihistamines, decongestants, allergy shots, antibiotics, inhalants, beta blockers, and oral contraceptives. Now that you are well aware of the symptoms of your patient, your main role starts here, because you have to examine the patient well. This physical examination includes blood pressure, pulse or electrocardiogram, breathing rate, temperature and weight, listening to their chest and heart with a stethoscope, thorough neck and skin exam, checking their arms and legs for swelling or discoloration, pushing on their abdomen. Now, what can cause breathing problems, and what is typical for each cause? Well, there are different causes of breathing problems that you should be clear about. If attack typically occurs after exposure to certain triggers, such as pollen, respiratory infections, and animals, then this might give you an indication that the patient has asthma. Well, asthma is recurrent attacks of wheezing, coughing, and shortness of breath, brought on by certain triggers. But if your patient has typical symptoms like easy fatigue, dizziness that occurs in certain positions, pallor, blood sometimes present in stool, then this might be an indication to anemia, which is low blood count. And what if your patient is having worsening symptoms with more weight gain? Breathing troubles appear with exertion or bending. No history of heart or lung disease. Then, these symptoms might be caused by obesity, which is in fact excess body weight, and if breathing problem is accompanied by wheezing, rapid breathing, gasping, turning blue, and loss of consciousness, unless the object is removed from the throat. Symptoms typically being while eating. Then foreign body aspiration might be a reason to this. Well, This is characterized as accidentally breathing in a foreign substance that blocks airways. Now, if the patient has breathing problems along with sudden onset, anxiety, chest pain, lightheadedness, tingling in the arms, legs, and around mouth, then this might give you an indication that patient has hyperventilation. Well, hyperventilation is defined as rapid and deep breathing. Now, if the patient shows symptoms like coughing up green or yellow sputum, fever or shaking, chills, coughing up blood, chest pain, rapid breathing, then this might give you an indication that patient has pneumonia. Well, pneumonia is a lung infection. Now, if the patient shows symptoms like sudden onset of breathing troubles, chest pain, may occur after chest injury, then this might give you an indication that patient has pneumothorax. Well, pneumothorax is collapsed lungs, an abnormal collection of air between lungs and chest wall. Now, if the patient shows symptoms like trouble breathing with exertion or at night, history of heart disease, history of high blood pressure, weight gain, then this might give you an indication that patient has congestive heart failure. Well, congestive heart failure is a state in which the heart becomes unable to pump enough blood to meet body's need. What if your patient is having confusion, lethargy, sleepiness, shallow or deep breathing? Then these symptoms might be caused by respiratory failure, which is in fact a condition in which the lungs cannot completely get rid of carbon dioxide. What if your patient is having severe breathing problems that worsen when lying down, rapid breathing, coughing up sputum? Then these symptoms might be caused by pulmonary edema, which is in fact a condition of collection of fluid in lungs. What if your patient is having cough, coughing up sputum, worsening after waking from sleep, more common in heavy smokers and people who are exposed to industrial dust? Then these symptoms might be caused by chronic obstructive pulmonary disease, which is a lung disease in which the lungs becomes damaged and cannot work properly. What if your patient has fever, night sweats, weight loss, and chronic cough? Most common in people with compromised immunity, such as AIDS. Then these symptoms might be caused by tuberculosis, which is in fact a condition caused by lung infection that spread to other parts of body. What if your patient has breathing problem along with chest pain or history of calf pain or leg immobilization, as on long trips, apprehension, sweating, feeling faint, cough or coughing up blood, rapid breathing? Then these symptoms might be caused by pulmonary infarction or emboli, which is a state of obstruction of blood vessel feeding the lungs, sometimes causing tissue death in the lungs. And lastly, if the patient has changes in cough patterns, coughing up blood, chest ache, more common in cigarette smokers, then this might be an indication that patient has lung tumor, which is defined as an abnormal growth of lungs in the cells. So now, if you are clear about your findings, you can manage your patient accordingly or do further investigations if required. That was all about the differential diagnosis of breathing problems. Stay tuned to sqadia.com for more such videos.